Welcome to Sciencera. In this video, we're going to discuss stomach anatomy from BD-Chourasia's Volume 2. In the last video, we looked at location of stomach. We saw size and capacity of stomach, shape, and let's begin with external features of stomach. The stomach has two orifices or openings, two curvatures or also known as borders, and two surfaces. So let's look at each of them one by one. Starting with the orifices or opening. The stomach has two openings. One is called cardiac opening. One is called cardiac opening and is joined by the lower end of esophagus, and other one is called the pyloric orifice and it opens into the duodenum. This is duodenum and this is the pyloric opening. Next is curvatures. Like orifice, stomach have two curvatures. One is called the lesser curvature and other one is called the greater curvature. Why curvature mean the border? So this one is the greater border. This is called greater curvature or greater border, and this is the smaller one compared to the greater one. So this is the lesser curvature. Lesser curvature is concave and forms the right border of stomach, while greater curvature is convex and forms the left border of stomach. Next are the two surfaces of stomach: anterior superior surface and posterior inferior surface. As the name says, anterior superior surface faces forward. Anterior mean forward and superior mean upward. So it faces forward and upward, and the other one is posterior inferior, which means backward. Posterior mean backward and inferior mean downward. So it faces backward and downward. Next is the parts of stomach. Two parts of stomach are divided into the four sub-parts. So the first part is highlighted in blue, which is divided into two: fundus and body. This one is divided into two: fundus and body. It is called the cardiac part because it is near the cardiac end. Other one is called the pyloric part, which is also divided into two: pylorus and pyloric antrum. This is called pyloric part because it is more closer to the pylorus. The fundus of a stomach is upper convex dome-shaped part situated above a horizontal line drawn at the level of cardiac orifice. Next is the body of stomach, which lies between fundus and pyloric antrum. Pyloric antrum is separated from pyloric canal by an inconstant sulcus, and then the pyloric canal is narrow and tubular, and it is a right end. It terminates at the pylorus. Next, we're going to look at relations of stomach, which means how stomach lies in relation to other organs or other parts of the body. Starting with the peritoneal relations, we know that stomach is lined by peritoneum on both its surface. At the lesser curvature, the layer of peritoneum lining the anterior and posterior surface meet and become continuous with lesser omentum. Along the greater parts of greater curvature, two layers meet to form the greater omentum. Near the fundus, two layers form two-layer meets and form the gastrosplenic ligament, and near cardiac end the peritoneum on the posterior surface is reflected on the diaphragm on the gastrosplenic ligament. Cranial to this ligament, a small part of posterior surface of stomach is in direct contact with diaphragm or left crus, and this area is called the bare area of stomach. Why? Because it is in direct contact with diaphragm. So lesser omentum stretches from the smaller curvature of stomach to liver. Greater omentum stretches from lower two-thirds of higher curvature to transverse colon. Gastrosplenic ligament goes from the upper one-third of higher curvature to the spleen near the hilum, and gastrosplenic ligament stretches from the uppermost part of the fundus to diaphragm. So in order to remember the peritoneal relations, we need to remember four key points: lesser omentum, greater omentum, gastrosplenic ligament, and gastrosplenic ligament. Moving on to visceral relations of stomach. First, we're going to look at anterior relation, which means we're going to look at the relations of anterior superior surface. On the right side of the surface, it is linked to gastric filling of the left lobe of liver, and near to the pylorus to the quadrate lobe of the liver. The left half of the surface is related to diaphragm and the rib cage. The lower part of the surface is associated with the anterior abdominal wall. The gastric triangle, as shown on the screen in blue, it is a triangular area of stomach in contact together with anterior abdominal wall. It's bounded on the left side by left costal margin, on the right side by the lower border of liver, and inferiorly by the transverse colon. In entire esophageal obstruction, gastrostomy is done in this area to feed the patient. Posterior relations of stomach. Posterior inferior surface is related to number of structures on posterior abdominal wall which jointly creates the stomach bed. These structures are diaphragm, left kidney, left suprarenal gland, pancreas, transverse mesocolon, left colic flexure, or also known as splenic flexure of colon, splenic artery, and spleen. All the structure creating the stomach bed are divided from the stomach by lesser sac with exception of spleen that is divided from stomach by the greatest sac of peritoneum. To remember all the posterior relations of stomach, you can use the mnemonic Dr. S3 kills patients mercilessly, where D stands for diaphragm, S3 stands for 3S, splenic artery, suprarenal gland, left suprarenal gland, and splenic flexure. K stands for kidney, P stands for pancreas, and M for mercilessly stands for mesocolon. Next is blood supply of stomach. Stomach has abundant atrial supply originated from the celiac trunk and its branches. The arteries supplying the stomach are left gastric artery, a direct branch from celiac trunk, right gastric artery, a branch of the common hepatic artery. Then we have left gastroepiploic artery, a branch of which is the branch of splenic artery. Then we have right gastroepiploic artery. This is the branch of gastroduodenal artery. Then we have short gastric arteries, which are about 5 to 7 in numbers. These are the branches of splenic artery. All these arteries supply stomach with blood. Next we have is venous drainage of stomach. So first we look at the arterial supply of the stomach. Now we're going to look at the veins which are supplying the stomach. Veins of stomach correspond to the arteries and drain directly or indirectly into the portal vein. The veins of stomach are left gastric vein. This one is the left gastric vein. And then we have right gastric veins. We have left gastroepiploic vein, right gastroepiploic vein, and then we have short gastric veins. Right and left gastric veins drain directly into the portal vein. Left gastroepiploic and short gastric vein drains into the splenic vein, and then right gastroepiploic vein empties into the superior mesenteric vein. Lymphatic drainage of stomach. First divide the stomach into right 2/3 and left 1/3 by lying along its long axis. Now we break up right 2/3 into upper 2/3 and lower 1/3 area, and left 1/3 into upper 1/3 and lower 2/3 area. This way 4 lymphatic glands are marked out by and numbered A, B, C and D. Way of lymphatic drainage from these 4 lymphatic territories into distinct group of lymph nodes are from area A, also known as pancreatosplenic area, empties into pancreaticosplenic nodes along the splenic artery. Area B is the largest area along the lesser curvature. The lymph from this area is drained into left gastric lymph nodes along the left gastric artery. These lymph nodes also drain the abdominal part of esophagus. Area C contains the pyloric antrum and pyloric canal along the greater curvature of stomach. The lymph from this area is drained into right gastroepiploic lymph nodes along the right gastroepiploic artery and pyloric nodes, which are located in angle between the first and second part of duodenum. Last we have is area D, which contains the pyloric antrum and pyloric canal along the lesser curvature of stomach. The lymph from this area is drained into right gastric nodes along the right gastric artery and hepatic nodes along the hepatic artery. The efferents from all these lymph nodes groups pass to the celiac node. Efferent from celiac nodes goes into the cisterna through intestinal lymph trunk. Nerve supply of stomach. Stomach has both sympathetic and parasympathetic innervation. Sympathetic fibers are originated from T6 to T10 spinal sections via greater splenic nerves and celiac and hepatic plexus. Sympathetic supply to stomach is A. Vasomotor, B. Motor of pyloric sphincter and inhibitory to staying gastric musculature, C. Act as the main nerve pathway to pain sensation from the stomach. Parasympathetic fibers are derived directly from the vagus nerve, which are anterior vagal trunk derived mostly from the left vagus nerve and posterior vagal trunk derived from the right vagus nerve. Let's look at anterior nerve supply of stomach. Anterior gastric nerve divide into a number of gastric branches for anterior surface of the fundus and body of stomach, and 2 pyloric branches are one for the pyloric antrum and another for the pylorus. Posterior nerve supply of stomach. Posterior gastric nerve divide into smaller gastric branches from posterior surface of the fundus and body and pyloric antrum. Large celiac branches for the celiac plexus. Parasympathetic nerves are motor and secretomotor to the stomach. Their stimulation causes increased motility of stomach and secretion of gastric juice rich in pepsin and HCl. These are the inhibitory to pyloric sphincter. Thank you for watching. If you like my video, don't forget to subscribe for more.